Welcome to Medical Edge. My name is Lisa Wilson. This program is produced as a partnership between the Mayo Clinic and the City of Thornton. We hope every episode provides valuable health information for you and your family.
Every day, millions of people swig down medications and supplements in the form of pills or capsules.
The idea is that they easily deliver medicine to the stomach or lower down the GI tract and kind of quickly pass through the esophagus.
Mayo Clinic gastroenterologist Dr. Karthik Ravi says sometimes pills get stuck on their way down. If this happens, you could be at risk of what's called pill-induced esophagitis. Here's what happens. A person swallows a pill and it gets hung up in the esophagus. The contents of the pill leak out and damage nearby tissue, causing an ulcer.
So typically patients are going to complain of chest pain. The chest pain is going to be pretty quick in onset. It's going to happen within a couple of hours to days of taking the tablet. It's going to be pretty severe. It can radiate to the back. It's typically worse when they swallow. And they sometimes will even notice that it may be more difficult to swallow.
What pills can cause esophagitis? Dr. Ravi says potentially any medication could, but the biggest culprits tend to be antibiotics, specifically doxycycline or tetracycline. Others include biphosphonates, which are medications for osteoporosis, nonsteroidal anti-inflammatories such as ibuprofen, and supplements such as iron and potassium.
Rarely there's long-term consequences. Usually people will develop symptoms pretty quickly, and once a diagnosis is made, we take away the pill. We'll oftentimes give people what we call anti-acid medications, so medicines called proton pump inhibitors. We might give them something to control the pain, and typically people get better within a week with really no long-term consequences. People can develop complications like strictures or narrowing of the esophagus, but those typically occur with repeated injury.
Most of the time, doctors can make a diagnosis after hearing about your symptoms. They may also perform an endoscopy to look inside your esophagus. So, how do you prevent pill-induced esophagitis? Follow directions on the bottles. Take medication with at least 8 ounces of water and don't lie down for 30 minutes afterwards.
Those are really the best things you can do to try to prevent developing pill esophagitis.
For Mayo Clinic News Network, I'm Vivian Williams. To Deborah Mendelson, exercise is a key part of health and happiness.
And I've even been doing a little jogging and walking, so that's what I love.
Like many women who have children, Deb developed stress, urinary incontinence, and pelvic organ prolapse.
So if I coughed or sneezed, I'd have to, wherever I was, I'd have to go home and change, and it was really inconvenienced.
Very common. So she opted to have doctors in her hometown implant pelvic mesh for both her incontinence and prolapse. It worked for several years.
And then I developed another prolapse, so I went back to my surgeon, who did further mesh surgery.
For a while, that worked too. Then the pain began.
A scale of 1 to 10 of the pain, my pain was probably at about 11 prior to the surgery. I was extremely distressed, and to be honest, I didn't feel my life was worth living. I had no quality of life at all.
Deborah's search for help led her to Mayo Clinic and urogynecologist Dr. John Gebhardt. He says the most common problems with mesh implants are erosions or extrusions, meaning the mesh starts to poke through tissue and skin.
Could lead to bleeding, irritation, discharge, maybe complaints with intercourse.
Here's what happens. Pelvic mesh is implanted to bolster organs, to give them support. Over time, the body grows in and around the mesh, and this holds the mesh in place. In some cases, the mesh contracts and begins to move, causing potentially serious symptoms. Surgery to take out embedded mesh can be very complicated and difficult.
We removed a significant majority of the mesh that was placed for her. We didn't remove it all because some areas weren't an issue.
Deborah has had 2 surgeries to remove the mesh. Some is still there, but she feels worlds better.
Absolutely fantastic.
Now she's back on track.
I have got back into physical activity, which is great.
Back into life. For the Mayo Clinic News Network, I'm Vivian Williams.
We see people who had never had problems with acne in their adolescence, but developing it in their 20s and 30s and 40s.
Mayo Clinic dermatologist Dr. Mark Davis says the medical world does not know exactly why adults get acne, but they do know how to treat it.
We use all the same things that you use for adolescent acne. So we use topical treatments and then oral treatments if the topicals don't work by themselves.
Dr. Davis says start with over-the-counter topical products that have benzoyl peroxide in them. Your doctor can also prescribe topical retinoids. If after 3 or 4 months your acne is not improving, the next method of attack is to add on prescription oral contraceptives or antibiotics. If after a couple more months there's still no improvement, there are a number of treatment options, including what's called spironolactone. In very rare cases, your doctor could prescribe isotretinoin, which is very effective, but it comes with side effects such as birth defects. And if you've got a big event coming up and you suddenly get a big pimple, steroid injections can work very well, but they're risky.
Because injecting a steroid can make that area of your skin become what we call atrophic. In other words, you might get a dimple in your skin instead of having the bump on your skin, and that can be permanent.
Dr. Davis also says no matter how clean you keep your skin, acne still happens.
Very difficult to prevent acne.
He suggests using a gentle soap, but when pimples do pop up, most adults can blot out the blemishes within weeks to months when armed with the proper tools of treatment. For the Mayo Clinic News Network, I'm Vivian Williams.
That's all for this episode of Medical Edge. To learn more about the stories featured on this program, you can find additional resources by visiting our website and following the link to the Mayo Clinic. Thanks for watching, and be sure to watch the next episode of Medical Edge.